Today, we're looking at a pretty innovative piece of tech that's designed to make daily care easier and, frankly, more dignified. So let's dive into the HOMSONS H1. It's an external urinary management system for men, and it's really changing the conversation around comfort and convenience.
If you're a caregiver or a patient yourself, this is a question you're probably asking all the time. The day-to-day reality of managing urinary incontinence or long-term bed rest is tough. The goal is always to find a solution that's safe, comfortable, and most importantly, maintains a person's dignity. And that leads us straight into what we can call the daily dilemma. On one side, you've got invasive catheters. Yeah, they can be effective, but they often come with real discomfort and a pretty serious risk of infection. And then on the other side, you've got absorbent pads. They can lead to spills, skin irritation, and just constant changing. Neither one is exactly an ideal solution, right? So, what if there was another way? This is where a non-invasive alternative comes into the picture. We're talking about an approach that's been designed from the get-go to put comfort and safety first, without all those major downsides of the traditional methods. So let's be super clear on what we're talking about.
The pump unit,
An external
two male
catheter
catheters.
system is exactly what it sounds like. It's a device worn on the outside of the body. It's built specifically to collect urine without any kind of painful insertion. And right away, that dramatically lowers the risk of internal infections and skin issues, as long as it's used correctly. Now, what's really cool here is just how wide-ranging the use cases are. Of course, it's for men who are managing urinary incontinence, but it's also a powerful tool for anyone on long-term bed rest. We're talking home care, nursing homes, hospitals, basically anywhere someone is looking for a more comfortable, less invasive option. Okay, so let's pop the hood on the HOMSONS H1 and really see how its design tackles these challenges head-on. The whole idea is combining smart technology with a simple, user-friendly approach.
First thing to notice is the capacity. The H01 is built with a 1,500 milliliter reservoir. Now, why is that number such a big deal? Well, for a patient, it could mean uninterrupted sleep through the night. And for a caregiver, it means less stress and a daily routine that's way more manageable and predictable.
But of course, a big reservoir is only useful if you know when it's getting full. And this is where the smart part of the design really shines. The system has an alert that just takes all the guesswork out of care. No more constant checking and rechecking. The device literally tells you when it needs attention. And that alert? It's super simple but effective. 10 clear beeps sound off when the container is full. It's an unmistakable signal that helps prevent spills before they can even happen. This kind of proactive alert is so crucial for hygiene and, just as importantly, for the patient's dignity.
And you might be wondering about power. Well, all this smart tech runs on a battery that lasts up to 2 weeks on a single charge. That kind of longevity makes it incredibly reliable, no matter the setting, a busy hospital or a quiet home. You can pretty much set it and forget about the power for a good long while.
So we've gone over the specs, but what does all this technology actually mean for the person using it?
And the benefits are very real. You've got an anti-leakage design, which brings peace of mind. It's lightweight, so it's not a burden to wear. And here's the kicker: no painful insertion. A user can lie down, sit, or even move around a bit, and the device stays secure. That offers a level of freedom that's often lost with other methods.
And it all really comes down to this. For people with sensitive skin or limited mobility, a solution like this can make a real difference in daily life. It's about so much more than just managing a medical condition. It's about improving quality of life.